All right, welcome to another episode of Consults Over Coffee, conversations about health and healthcare. I'm Dr. Michael Jones, and I'm joined today by one of my old colleagues, Ann Leggett, GI nurse practitioner working primarily at VCU Health Systems, affectionately known as MCV, despite the name change.
Multiple name changes.
Multiple name changes. Thanks for joining me today.
Thanks for having me.
Yeah. So we did a lot of work together dealing with irritable bowel syndrome and functional digestive diseases.
Yes.
I think actually you had just finished your GI nurse practitioner gig.
You did. You gave me my first job, and I'm still there. And you're long gone. What happened?
There's still more for you to learn.
Apparently, it never ends.
So, yeah. Well, I think we kind of hit it off because I've always sort of taken more of a holistic mind-body approach to these things, and your background.
I always said the only reason I got the job was because I have a degree in psychology.
You can't be. I don't think you could be in healthcare without a degree in psychology.
I know. My mom
you have to
actually.
understand people.
My mom said when I got the job and when I started transitioning from psychology more to nursing, she goes, "Oh, that's a shame you're not going to use that degree anymore." And I said, "Actually, I use it more now than I did when I was a psychologist."
Yeah, absolutely, and especially I think for a lot of the digestive things.
Oh, definitely.
Anything,
Definitely.
Frank. I mean, the effects of stress on digestive function.
Yeah,
Effects of stress on well-being.
absolutely.
Effects of stress, detrimental effects of stress on immune function.
Pretty much anything.
On anything, yeah.
Pretty much anything.
Exactly. I think I was talking to
The
a guy.
effects of stress,
I was talking to a guy on the
dot.
phone earlier today, and that's what I said. He was like, "Why do they always want to blame it on stress?" I said, "Well, the list of things improved by stress is pretty short."
Yeah.
Right.
Exactly.
So, and in our world, stress doesn't do kind things to your digestive
It does
tract.
not. It does not at all. I always say that the brain and the gut are like best friends. If one's not happy, neither is the other.
Exactly.
So,
Exactly.
it's,
Speaking of which, I mean, in 2020 has probably not been the best year for digestion.
no, I've definitely seen a lot of my people not feeling their best this year. So it's definitely just more proof of the connection between how outside stressors can affect you physically. So
Well, yeah, and I think, the other part of that is, we used to say digestion is the luxury of the unthreatened animal, right?
absolutely,
There is no survival advantage to digesting a cheeseburger.
no.
You can't run for your life.
You take a nap,
Take a nap, exactly.
Yeah.
And
Then-
be
then
eaten
you
by
die.
a predator.
then you die.
And then so yeah, if your central nervous system perceives things as being in stress mode, it really kind of takes
Yeah,
your gut offline.
It does. Shuts it right down.
So
Gotta be ready.
That V8 runs on 6 cylinders and sputters and knocks and does all kinds of weird things that are unpleasant to people.
Exactly.
And it's just-
Exactly.
So, and that I think becomes important is sort of the evaluation of those folks, is at least to ask those questions.
Yes. So, most people come and they want a diagnosis. They want to know what's wrong with me. And when you can't give them anything more than, hey, lucky you've got IBS, they're not really, at least initially, not really happy because they feel like that's still not an answer. And there's not a clear-cut path as to how you treat it. Because unlike something like inflammatory bowel disease where you have all these guidelines and, flow charts that you can follow to adequately manage Crohn's disease or ulcerative colitis, you don't have that with IBS. It's going to be different for every person.
Well, and so when you tell somebody that they have IBS, how do you define that for them?
I usually have to at least do some form of testing to back it up because they're going to be like, well, what if you're missing something? What if what if we don't do this and you miss so you do kind of run some tests. You don't have to go too crazy, but depending on what the symptoms are, there may be endoscopy involved, there may be a CT scan, there's lab work, things like that where you can rule out other things. And I think once I've confidently, and you also take it with a grain of salt. You also have to listen to their story. If their story screams IBS, you're not going to go down this really super extensive workup because you kind of already know what's going on, but you just need to get them on board.
Right.
And it amazes me how many people are actually disappointed when I don't find something. I'm like, really? I'd be doing backflips. Yay, I'm okay.
I think that's an interesting observation, and I get that we all like.
We like answers.
Yeah, nice tidy packages.
Yeah. Wrap it up.
And easy solutions.
Mm-hmm.
And it is disappointing to not have a clear answer.
Yeah.
But at the same time, like I've had people cry.
Absolutely.
After a negative colonoscopy,
after a good workup,
or a normal CT
Yes.
scan, and I'm thinking to myself, I get like there's a level of frustration
Sure.
and apprehension that there's more to the story.
People want an answer. They want an answer, and they want it to be a nice, easy fix.
Well, we all want the same thing. We
Yeah.
want simple, easy solutions that generally somebody else will do for us.
Yeah, exactly. You don't want to be told that
It's
you need
generally
to.
how I roll.
You don't want to be told that it's something you're eating, or you're not exercising enough, or maybe you need to lose some weight, or they don't want to hear that
Right,
because
or-
that takes
or-
effort.
or that relationship that you're in. There's a whole lot more that makes your gut work or not work
Yeah,
other than what you're eating.
exactly.
And
Exactly.
the world that we live in has, and how we
Huge
interpret that and
impact
deal
on
with that
that.
has a huge impact.
Absolutely, absolutely.
And then, I think your comment about, people, and we were talking a little bit about people not being reassured.
Mm-hmm.
Do you think that to some extent that has to do with the fact that IBS, irritable bowel syndrome, in the community, most people's experience is that it was kind of a blow-off diagnosis
Absolutely.
that they got.
They feel dismissed.
Yeah, and do you make efforts when you see those folks to really kind of explain to them, like, exactly, well, IBS is different than just chronic diarrhea or chronic nausea, that exactly.
So I think that, you have to spend time. I think the one thing that people that have these issues really want is time. They just want to. They want to feel like they're heard. I think a lot of times they do. They get the full workup. They get their negative test results, and they're like, okay, well, I can't really do anything else for you. Move on to the next provider. I think just sitting there and letting them have that time to explain everything, because I think a lot of times they get cut off. They get, well, that's, just, I'm telling you, this is what it is. They don't feel like they can tell their story. And so by letting them have that time and listening to them, and I think that helps, establish just a relationship, a more trusting relationship than maybe they've had with other providers. But it also helps me understand where all of this is kind of stemming from.
The money is in the story. And when you start to deal with something like the functional digestive disorders, irritable bowel syndrome, where there's not necessarily, here, take this pill,
No.
and you will be cured, or I will anoint you, and you
Right.
will leave here symptom-free, never have a problem again.
Very rarely does that happen.
Very rarely does that happen, but I think healing has a lot to do with connectedness.
Absolutely.
And if you engage with someone who hears your story and truly that you feel that you're being heard,
Right.
that you're being valued, that you're being taken seriously,
Yeah.
and that someone cares about your situation in your life, that in and of itself has...
I mean, I have people that have said, before I've even done anything, by the time they come for like a second visit, they say, I already feel a little bit better, just because I feel like I finally found someone who gets it.
You get it right. You understand. You heard me.
Yeah.
You listen to me.
I think that's.
And I
a big
think
chunk of
if
it.
you're in healthcare, if you're in medicine, that may be one of the greatest compliments you ever get.
Yeah.
Is that someone says, you know what? He heard me. He listened to me.
He understands. Yep.
And that really is. That's
It
just,
is.
and that's
It
the
is.
art. That is the art of medicine, is
Right.
forging.
People are individuals and they need to be treated as such. It's not, what one medication or one intervention is not going to work for every single person. And so it's really trying to figure out how to best help someone overall, not just with
So,
one
so
thing.
let's back up and talk about it. So the first thing is you see these folks and
Yes.
you have a conversation with them, you've reviewed any records that
Mm-hmm.
they come. What's your definition of irritable bowel syndrome? You say to somebody,
So
Rome criteria.
Rome criteria would be abdominal pain in the setting of a change in bowel habits. That's pretty much what the definition of IBS is. So anyone that has maybe just the change in bowel habits, like they're just constipated, they're just having diarrhea, or they alternate between the two, they don't really have the pain, wouldn't technically be IBS, but it still kind of falls under the same umbrella.
Well, it's under the realm of
Functional,
what we call
FGID.
right? Which basically parts look good, motor runs bad.
Exactly.
It's sort of the Cliff Notes version of that.
Exactly.
But irritable bowel syndrome is under that heading of functional gastrointestinal disorders.
Right.
Or now, what are they? Disorders of the brain-gut axis is now is that the new nomenclature?
It's hard to keep up.
Which I think is nice in that it really kind of highlights the broad nature, the holistic nature of
it
this
does,
problem.
because that's the first time it's really brought.
So I think you kind of make that definition.
Yeah.
It's primarily a pain irritable
Yes.
bowel syndrome
It's
is primarily a pain
disorder. Yes.
that has associated bowel habit changes.
Right.
And the pain generally, to some extent, fluctuates with the bowel
bowels,
habit change,
yep.
either for better or worse.
Correct.
And I think, making that more of an affirmation of the fact that, your stomach rumbles is not irritable bowel syndrome. It may be something else. It may
Right.
be under that heading, but
it's
look,
not
there's
technically,
specificity here and there's value here, and that it also
There's a
helps.
lot of people that will come in saying, "Oh, I have IBS. I've had IBS for years," but they have completely normal bowel habits and just have pain or just have nausea or just have. And I'm like, well, that's
Right.
technically that's not it.
Right, it's a functional gastrointestinal
Right.
disorder or disorder of
Yeah.
brain gut axis or whatever.
So
So
I
I think that helps, though, right?
Yeah.
I mean, to kind
just
of go,
explaining it to them.
That-
Explain to them what it is, because a lot of them don't even really get that. They just say they get their, like I said, they get their normal results. They get kind of dismissed, and they say, "Oh, you just have this. You'll be fine. Take a little fiber. Take a little Bentyl. You'll be okay." And they do that, and it still doesn't. They're still not feeling great. So because there's so much more to it than just trying to fix whatever their cluster of symptoms may be.
it's all symptom driven.
It is.
But then
It
that
is.
also kind of comes down to getting enough of a story to kind of understand, or what are the things that are driving the symptoms.
Yeah. This didn't just come out of the blue. Where did this come from?
And so we kind of have talked a little bit about, stress as a trigger for a lot of this.
Yes.
List of things made better by stress is
0.
short.
I would say 0.
Yeah, I mean, and stress
Stress is a killer, man. Stress is just
Stress is the 800-pound gorilla that nobody wants
to talk about. Yep.
But
It is, and you can't avoid it. It's everywhere. You can't avoid it, but you can help. You can help yourself. You can help your mind and your body and how it reacts to it. If you can take care of yourself, you're not going to be able to avoid all stress. I mean, some stress is good. A little bit of stress is good. But you have to learn how to manage it so it doesn't become toxic.
well, or at least so you can recognize when that happens.
When it
or
happens,
what's driving
right.
it. Because that even of itself, that I think for a lot of people, it's the unpredictability.
It is. And they also, and a lot of, I find this with a lot of people, they're still, even though they've had the symptoms for 20 years, they're still worried that they're going to die from it. And I'm like, if it hasn't killed you yet, it's probably not gonna.
It's true. You're not dead by now.
You're not dead by now. Then there's no cancer that I know of that will take that long to kill you.
But I think a lot of people do. They
do.
They feel the pain.
Right.
And
It gets their attention.
Well, and as pain, that's what pain
Often
is supposed
does.
to do.
And then they think, well, what is that?
Well, it's harming me.
Yes.
Harm is being done.
This has got to be something bad.
Right.
And then that, of course, heightens the anxiety, which then often makes the pain worse.
Right. Well,
Which then
anxiety
reaffirms the fact that they're dying.
Absolutely.
And it's like a hamster wheel that they can't get off of.
Well, and that's kind of part of what anxiety is.
Yes.
Is that
It is a hamster wheel.
Well, and it can be certainly symptom inducing, but
Absolutely.
it's also, people become hyper vigilant. I mean,
They
if
do.
you're walking down an alley, a dark alley at night, and you're a bottle break behind you,
You're
you
gonna
become
take
anxious.
notice.
But everything gets louder
Yes.
because you're now
Yeah.
in this heightened state of awareness, because of the threat.
Correct.
You're vigilant,
Yeah.
hyper vigilant.
Yes.
And that vigilance is both to external and internal stimulation,
Absolutely.
in which, and so it does become a very kind of a feed forward cycle in a lot
Right.
of ways. We used to say nobody's gut ever got better when they were worried about their gut.
No. It gets worse.
It gets worse.
It gets
And,
worse.
and so, what percentage of people would you say have some insight? Well, or let me two-part question.
Okay.
What percentage of people do you think dealing with stress or emotional triggers plays a role in their irritable bowel syndrome?
I mean, I think if you've got these external stressors and triggers, it's gonna make your symptoms worse. Especially if you're not. And it's not that they're not insightful, because they may be very well aware of the connection.
This is the other part of the question, which
Okay.
is what percentage of those people
Are aware of it.
have some right.
Some insight. Smaller amount, definitely. But I'm actually finding more and more people are at least making that connection. And I don't know if it's because this is something that's talked about more frequently now than it was 10 years ago. But it's still a low percentage. I would say half, maybe 40 to 50% maybe have some insight. Now, that increases when I talk to them. They're like, oh, okay, well, now this makes sense. And so they just need like a nudge in that direction. But there's always going to be a small group of people that just will not own that.
Right. Right.
No, that's not at
It's
all
life.
what's going. Yeah.
That's life.
Exactly.
Well, so in terms of therapy for this, I mean, we kind of talked about everybody gets handed fiber, which probably makes more people worse than it makes better.
Yeah.
Fiber's good for probably
Bloating.
very simple constipation.
That's about it.
But
Pretty
that's
straightforward.
Horrible for irritable bowel
Yes.
syndrome. If anybody says to me they have problems with bloating, handing them fiber will instantly amplify
Yes.
their symptoms by probably an order
Don't
of
do
two.
it. Yes.
Yeah. So, but certainly you mentioned, there are medications like dicyclomine, bentyl
Sure.
for crampy abdominal pain that
Right.
can be helpful. There's medications to, as I tell people, I can make you poop more. I can make you
Yeah.
poop less. I can't really necessarily make you poop just right.
Just right. Exactly.
I can
Exactly.
speed it up or slow it down.
We
and
can
make it
do
hurt.
that. We can work with those,
But-
but yeah, it's never going to be perfect.
But I kind of wanted to talk about, because the one thing that really kind of ties it all together, and that may be the closest thing that we had to a timing light to adjust the function of the gender, was the gut-directed hypnotherapy piece.
Yep.
The behavioral thing. And you've been doing that now for,
8 years.
holy smokes,
Yeah.
been that long.
Well, you hired me, and I immediately got trained to do it. And
So-
I've been in this position for 8 years.
So, can you just briefly, how's that work?
So basically, there is a doctor who developed this protocol. And there's actually two now. There's one for lower GI, more IBS-like symptoms, and then there's a similar one for functional GERD, reflux, dyspepsia. We'll focus more on the IBS one because that's what we've kind of been talking about. But so you have somebody who does understand that stress is likely playing a role in their symptoms or driving their symptoms. Those are typically the ones that do the best with hypnosis, or the ones that do have some insight and can kind of understand. Most people have a misconception about hypnotherapy, thinking I'm going to make them cluck like a chicken, or
Right. So, what exactly is hypnosis?
So hypnosis is-
in a medical setting, not in a
It's-
carnival setting.
It's basically you're not asleep, you're not fully awake. You're in this really super relaxed state where your subconscious is just more open to the suggestions that are presented to you. Which in this case, for what I do, the suggestions are specific to your symptoms, your gut, typically bowel habits and or pain. And so it helps to sort of retrain the brain as to how the symptoms are affecting it, or how the symptoms are, how you're allowing the symptoms to affect you physically. Because the more you focus on the symptoms, the more you worry about the symptoms, the more you stress about the symptoms, the worse the symptoms get. With the hypnotherapy, the suggestions are usually directed towards minimizing the amount of pain you experience, or your bowel habits, your bowels will move more regularly. So it's these simple suggestions that are presented to you when you're relaxed that help you sort of get it a little bit better controlled. And I've had people that were on chronic narcotics, or narcotics for chronic pain, come off narcotics and never heard from them again. They're doing great. So there's a very small subset of people who this can be almost like a cure for them. But for the most part, it's more, the more realistic way to look at it is another tool for the toolbox.
Does it change, like, autonomic nerve, because we talked a little bit about fight or flight responses.
Yeah.
And then the other side of that coin is the parasympathetic nervous system, which
Right.
is like, go have the
Rest and
cheeseburger, life
digest.
is good.
Yeah.
Right. It's time to digest.
Yeah.
Does it swing that needle a little bit?
It does.
From the fight or flight side of your limbic system
To the parasympathetic,
side?
yeah.
So,
It does. And it's hard to really study it from because it's so many of the symptoms are subjective. So much of the data would have to be is subjective data that they can collect. There's not. I mean, I think you can. There have been some studies where they've collected cortisol levels, I believe,
Right.
and there have been significant changes in cortisol levels. But outside of that, there's not a lot of stuff that you can collect.
There's good symptom reduction. I mean,
Absolutely.
You're right. It's hard to study.
It's hard to give someone numbers.
And it's hard to study digestive physiology
Right.
while you're trying to get somebody to relax.
Exactly. But yeah, no, I would say that I've done this, I can't even count how many times, hundreds of people have completed. It's a 7-session protocol that I use. And I mean, 80%, 85% feel some sort of improvement in their symptoms. It'll vary, how much improvement, but typically they all feel better, and some of it they can feel almost immediately. Like I'll have people that come in and they're physically in pain when I'm starting the session. When I'm done, they're like, I actually feel a lot better
Feel
right
better.
now. Yeah.
I've
had people say that their shoulder didn't even hurt anymore, and I'm like, well, that's just an added bonus. I wasn't going for that. bonus. Sweet. But
No,
it
I think
does.
that's true. There are people, they walk and they feel better after
They
they
do.
it. And the goal is they learn how to do this themselves. Right?
Yes, because after a couple of sessions, they get sent a home session that they can kind of incorporate, because the sessions are spaced out 2 to 4 weeks. That tends to be kind of the sweet spot where they saw the best results and the most symptom reduction. And so, you come see me on, Tuesday, and you're not going to see me for another 3 weeks, but gosh, a week later, you're doubled over in the worst pain of your life. You have a home session that you can listen to kind of help you through that time.
Well, and that's kind of the beauty of this, is that ultimately you're teaching people how, or giving them the tools to help manage.
Yeah. So they don't need to come see me every 2 to 4 weeks.
The goal being stay out of the healthcare system. Right.
Yeah.
I mean, and to not be dependent on medication, because a lot of the folks we see, these are younger people.
Yeah, 20s, 30s,
Right,
teens.
and so what are you going to, you want to be on pills for the rest of your life? No,
Yeah.
you don't.
No.
If there's a way that you can manage this.
Correct. Without
medications, without the expense of medications, with the adverse reactions to medications.
Yeah. And I mean, if you think about it, any medicine you're taking is going through that very sensitive digestive tract. And, you can't look at a medicine's adverse side effect list without seeing a whole host of
Digestive
GI stuff.
Yeah.
You
No, I
know?
think that's true. I mean, in the literature, there are good outcomes data
Sure.
for gut-directed hypnotherapy.
Yeah.
I mean,
Absolutely.
well done. It's actually of anything we hand to people for functional digestive diseases.
One of the most effective treatments.
Yeah, I think, and well done studies. I mean, not necessarily placebo controlled, but
I think that's what some people like to see.
But there are like attention control where, okay, you get randomized to gut-directed hypnotherapy or we'll talk to you for the same period of time about
Right.
your symptoms or
Yeah.
education about irritable bowel. So there's a time control in there
Right.
as well.
Sure.
I mean, so these are well-designed
Yeah.
trials, and you know, a lot of the interesting thing that I found with the functional GI literature is that if you look, the placebo response in
Yeah.
trials is like 40 to 45%.
Yeah.
Which is phenomenal. Which I think, you know, on the one hand, people think, well, placebo is kind of bogus. It's just, you know, it's sort of like you're getting over on people. But I always thought the placebo response is like, well, that's the healing part. That's the
Right.
medicine part.
Yeah.
You know, because one of the really interesting things I think is that one of the dominant determinants of outcomes in life and in medicine and in irritable bowel syndrome is expectancy.
Mm-hmm.
That if you walk out the door thinking it's going to work,
Right.
it's much more likely to work.
And that's one conversation that I have with people, because I always see someone before I do hypnosis. I will do a session, just like a regular face-to-face clinic visit, where we talk about it so they can kind of understand what's gonna, you know, what it's all about, how this can help. But I also want to make sure I manage their expectations. If they think that I'm all of a sudden going to put an end to their 25-year history of abdominal pain, no.
Exactly.
And I have to make sure they understand that, because they need to have realistic expectations.
right. You're looking for symptom reduction,
Right.
symptom control.
We're looking for improvement.
Sure.
Anything that's less than what you're going through right now is going to be a win in my book.
And I think a lot of times once people finally get that sense that you're listening to them, you're knowledgeable,
Yeah.
you want to help them, and you've done a couple things that maybe get them some incremental gains,
Mm-hmm.
then suddenly it's not as overwhelming or as frightening.
No. I think so after the first time I speak with them, when I have just kind of an intake session, and then they come back for their first session, I always assume not much has changed because we haven't really done anything yet. But there have actually been times where people come in and say, I already feel a little bit better, just because I feel like this is where I need to be. This is what this is going to help me. And so because they feel like they have been able to tell their story, they have been heard, then that right there it starts it before I even start the hypnosis. Starts the healing process.
And I think, you know, that's again you've raised a lot of really important points, at least from my approach to medicine, which is probably the most important things we do in medicine aren't pills.
No.
It's, again, I've listened to your story. I heard your story. You felt heard.
Right.
The patient felt that, you know what, that guy paid it. They listened to me.
You can't be
And-
sitting there typing
and-
on the computer while they're talking.
You can't be exactly typing
Eye
your
contact
note.
is important.
Right, like an actual conversation. And I've had that where people have said to me, well, you know, you get this mountain of records, and they come in and sit down, and you go, so, and I always kind of start with,
Tell
how
me
can I
your
help
story.
you? Tell me your story. What can I do for you? And a lot of times, and I think just probably out of frustration, they'll say, well, did you look at my records?
Did you get my stack?
And my response is, yeah, but if the answer was in that, you wouldn't be sitting here right now.
Yeah.
So let's talk about what's going on.
Exactly.
Because the money is in the story.
Absolutely.
And so, but I think, you know, when you hear that, you listen to them, they feel heard.
Mm-hmm. And
you validate their symptoms, and you've instituted now a therapy that is efficacious. Not
minimal, no side effects.
No side effects, and again,
it's not going to make you feel any worse. I can guarantee you that.
Exactly, and you know, I think so you do a tremendous amount of good for people. It doesn't involve going to the pharmacy.
No.
It doesn't involve being in the healthcare. The goal here is not to keep people coming back to the office.
Exactly.
The goal here is to get them out living their lives.
Live life.
Yeah.
I mean, it's a beautiful day. Enjoy it.
It's a gorgeous day. So that's great. I appreciate your taking the time to sit down and talk about this.
No problem. Happy.
And then if folks,
to talk.
if who are the folks that they just, to kind of wrap up, you're obviously still down at MCV.
Yes.
In the Division of Gastroenterology and
Yes.
Hepatology.
Yes.
So folks can track you
They
down
can
there.
track me down there.
And that would be, and that would be That would be great, because you're one of the few people in this area who knows how to
in
do
Central Virginia that does it.
gut-directed hypnotherapy.
People come from all over.
Well, it's been great catching up with you.
You
Thanks
too.
for sharing your experience on all of this. Well, that's another session of consults over coffee with Mike Jones and Ann Leggett today.